Welcome, everybody, and happy Veganuary. We're excited to have another webinar on the benefits of plant-based diets for health, the environment, and social justice. We've got an awesome group here, so I'm really excited about this today. We'll just jump right in and start with some of the benefits of plant-based diets for health. So I'd like to introduce our first speaker, who is Dr. Mauricio Gonzalez, who's a triple boarded physician in internal medicine, emergency medicine, and obesity medicine at New York City Health and Hospitals Metropolitan. He's a leading expert sharing evidence-based health information on social media, so definitely check that out. He also started the Veggie Power Summit in Latin America. Dr. Gonzalez will discuss the health benefits of plant-based diets and specifically about protein.
Thank you, Dr. Loeb. Thank you, everybody, for being here with this amazing panel with such knowledgeable celebrities in my world, because promoting health is one of the most pressing issues in our world today. Plant-based nutrition is incredibly complex, but at the same time is incredibly simple. We know for a fact, we have tons of data showing the benefits of not only going 100% plant-based, but just moving along that scale towards more plant-based nutrition. It's, it can create amazing benefits for ourselves and for the planet. For humans, we have very, very good detailed data showing reduced incidence of cardiovascular diseases, less incidence of diabetes, obesity, and so yeah, it's very healthy. Now, there has been a lingering question among academics for many, many years, I would say at the very least 3 decades, which is plant-based protein enough to sustain and promote growth? This hasn't been simple to solve because there's a lot of variables. So what I'm planning to do in the next 5 minutes or so is just give you a very brief review of the evidence. First of all, we're in 2023. So the reason for eating good quality protein is not only for proper growth, is to reduce also the incidence of obesity and to reach maturity with a good muscle mass, right? So it's different. It's not only promoting growth, it's also keeping you healthy for a long time. And this changes things a little bit. First, one of the biggest questions we have is plant-based protein enough to sustain a good pregnancy? That has been a very, very big question for the last 10 years. And fortunately, the answer is yes. We have excellent data showing that plant-based nutrition and plant-based protein per se can not only sustain a good pregnancy, it can also be associated with less incidence of things like preeclampsia. So again, good news in that regard. But let's be honest, we didn't have a randomized control trial to back that up. But recently, thank you to Dr. Sachs and his collaborators, we know that the DASH diet, which is predominantly plant-based, has been associated to less adverse effects in patients with gestational diabetes. So less incidence of insulin use and also less incidence of C-sections. So again, it seems like a predominant plant-based nutrition not only is enough to sustain growth, but also to reduce adverse events during pregnancy. So far, so good. Now, in the past, WHO and all these big organizations used to promote that in order for us to keep our muscle mass stable and even grow it a little bit, we needed 0.8 grams of protein per kilogram of body weight. Unfortunately, things have been changing dramatically, and now we understand that it's possible that we need some more, okay? Perhaps 1 gram per kilogram of body weight, and in some instances, people with chronic diseases or people over 60 years of age, it's possible that we might even need a little bit more, 1.2. And that's a good thing. Now the question is, but can these 1.2 grams of protein per kilogram of body weight, can they come from plant-based sources? And the answer is yes. Will it promote growth, increase in muscle mass? Yes, Absolutely, yes. And we have excellent data. And one of my favorite studies to back this up was a randomized control trial where they took patients with liver disease. We all know how difficult it is for liver disease patients with cirrhosis, to keep a normal, stable muscle mass. That's an uphill battle for every physician. So we have a randomized control trial that showed that when patients with cirrhosis implemented mostly, that means 92–93% of the protein intake was plant-based, an amount of 1.2 to 1.5 grams per kilogram of body weight. In 6 months, all these patients increase their muscle mass, shown by the brachial perimeter. They increase their albumin content and overall strength. So that, to me, as a physician, that's enough evidence that plant-based protein can be incredibly efficient to keep you healthy and increase your muscle mass. For people who are interested in increasing their muscle mass, to look better, to have bigger guns, the summer is coming at some point. We also know that plant-based nutrition is more than enough. We know that there's a specific amino acid, leucine, that somehow stimulates the entire MPS machinery, which is muscle protein synthesis. And we know that when we consume more plant-based protein, like let's say 1.2, 1.5 grams per kilogram of body weight, that happens. Our muscle mass, if it's stimulated through strength exercise, it will grow. Not only that, Dr. Walter Willett from Harvard has shown in a very, very detailed meta-analysis that plant-based protein is also associated with longevity. So to make a quick summary, now we know that plant-based protein can sustain proper growth, can reduce adverse effects in pregnancy, especially among high-risk patients, can also help people with certain conditions that make muscle mass increase very difficult, and in people who are athletes or health enthusiasts, it can also help. My favorite sources of plant-based proteins are legumes, of course. Lentils, the best. But there are also concentrated protein sources that we should all be aware of, like tofu, tempeh, seitan, and there's a new change of technology giving us an amazing variety of new plant-based proteins, such as the vegan egg, which is basically a dehydrated legume that increases the amount of protein per serving, and so on. So that's going to be my quick 3-minute intro. Maybe later we can touch upon some other details, but I think this should suffice for now.
Fantastic. Well, thank you so much. That was great. Let's jump next to Martin Rowe, who is a senior fellow at Brighter Green, the executive director of the Culture and Animals Foundation, and co-founder of Lantern Publishing and Media. He's the author of several books and generator of the Vegan America Project. Martin will discuss why plant-based diets are important for the environment.
Okay, thank you for inviting me to speak today. So I'm coming at this from a bit left field in terms of plant-based nutrition. And given that I, only had sort of 5 to 8 minutes to be able to speak about the entirety of the environment and plant-based nutrition, I've decided to focus on a particular story that I think encompasses a whole range of issues and ideas that you will see intersect well with our obligations in terms of adopting a plant-based diet, especially for those of us who can afford it and who have access to those fruits, vegetables, legumes, nuts, seeds, grains, etc. So I'm going to share my screen and move to my PowerPoint slideshow. So I will be referring to my notes as well, so I'll be looking down as well. So this is an intersectional case study. Brighter Green, the organization I belong to, is a nonprofit action tank. That means we have policies on the ground as well as thinking about them. that works to transform public policy and dialogue on the environment, animals, and sustainability, both globally and locally. Through its food policy and equity program, Brighter Green specializes in policy papers and videos on climate change and the globalization of industrial animal agriculture, i.e. factory farming. So today I'm going to talk about a story that I first came across in November 2018, in which fishing communities on the coast of West Africa, in this case between Senegal and Mauritania, were clashing. And there were people being injured and fishing boats being sunk and some people being killed. So I'm going to talk a little bit about, go deeper into that story and why it's so resonant to me and why it makes so much of an impact when we think about plant-based food. So what is happening? Well, the reason why these fishing communities were fighting one another is there were fewer and fewer fish. And why were there fewer and fewer fish? Because big fleets from East Asia, Japan, China, South Korea, as well as the EU and Russia were bringing in their enormous vessels and fishing illegally. Sometimes they were fishing in international waters, but they were also encroaching on those, on the locals' areas. What were they doing with that fish? Well, what was happening was they were catching that fish and actually bringing it to shore where they had established fish meal and fish oil processing facilities on the coast, which were owned by these countries, mainly China, and operated by them. In the process of catching that fish and then processing it, they were polluting nearby water sources, including wells and rivers and riparian habitat, as well as the beaches for which tourists provided a good deal of revenue to accompany the fishing communities. That fish meal was overwhelmingly being used for aquaculture. In other words, the fish was being ground up and then fed. The pelagic fish, the sea-based fish, were being ground up for fish meal, which was then being fed to fish, carnivorous fish and not even carnivorous fish, sometimes non-carnivorous fish who had to be taught to eat other fish in aquaculture, often in East Asia, but also sometimes in Europe. The fish that were then grown were sometimes then sold back to West Africa at a greater expense. The fish meal was also being used to fatten pigs for market in East Asia and in Europe. So that's what was happening with this industry. So why were the Chinese and Russian and European Union and other vessels off the coast of West Africa? Well, one of the reasons was because they had overfished. But what happens when the fish vanish? Well, fish are actually a major source of protein on the African coast. The reasons for that are multiple, but it also includes the colonization of the West African diet and the loss of many forms of protein in the form of many legumes and beans because of a modernization, in quotes, of the African diet. But fish are a source of protein, and when there is less protein available for these small fishing communities, there is deprivation, there is protein deficiency. What happens socially when the men who are no longer able to live from their fishing lose their jobs because there are no more fish to catch? They go from the coast into the major cities in search of jobs, which has been the case for many, many communities all over the United States all over the world, including the United States, when there are no more jobs in rural areas. That, of course, leads to community and family breakdown and often leads to the spread of diseases when the people who go to the cities come back to the rural areas. Those men who can't go to the cities there take to the open waters, which are very dangerous and may drown by boat, or they attempt to cross the Sahara, where they are subject to either death because they don't make it, or they are captured either on the open seas, they are by piracy, or by trafficking by essentially terrorists and essentially human traffickers When they do make it to the coasts of Libya and Algeria and Morocco, they try and flee in boats across the Mediterranean, which of course leads to further deaths and ultimately leads to hardened immigration policies in Europe, which means that you have the rise, I would say, of sort of an ethno-nationalism as a consequence of the loss of jobs in West Africa. What also happens is that young men become radicalized, which leads to more social destabilization. So why are the international fleets there? Because they've overfished their own waters. In some cases, there's the eutrophication, which means the deoxygenization of the water, which is caused by the high nitrogen level runoff from artificial fertilizers, which are polluting the waterways, as well as pollution in their own areas, caused by multiple regions. And the West African fish stocks are currently still plentiful, but of course they are dying off. Now, it's only a dozen or so nations that are doing this fishing, but few are punished. And why are they not punished? Because right now, despite there being efforts to create some kind of law on the open seas, seas are a place of human trafficking and other kinds of trafficking, and they are considered an infinite resource. Fish, of course, are weighed by the ton. They're not individuals, they are mass terms. And until very recently, we have seen fish as just an infinitely renewable resource. What needs to be understood is that even though these fleets are privately or quasi-privately owned, they are supported by their governments. So these governments have been urging their fishing fleets to go around the world and vacuum up as much fish as possible. And all of this shows that for all of the attempts for governments to regulate industry and government across the world, wherever you may be, are often hand in glove. And this is a function of a globalized economy, which is bent at the moment, apparently, on the destruction of all ecosystems. So as you sit here and listen to this story, and as I read this story, you're asking to yourself, why is this happening? What on earth is making this possible? Well, there's poor governance. Poor governance, not only in terms of governance structures in the global north, the developed world, but also in the global south, where it is not as hard as it should be to bribe local officials, to provide kickbacks, and where often communities are being led by individuals who do not see the long-term future of the survival of their communities. And there's a lack of accountability, whether it's a multinational corporation or a local government or a national government or a regional government. And all of this is a function of the externalization of costs, that we don't pay for the polluted water, that the industry doesn't pay for the polluted water or the polluted air or the loss of fishes or the desertification of the land, wherever it may be. So we need to internalize those costs to make the cost of these quote unquote renewable resources genuinely as high as the costs they have to the environment and to local communities. But right now, globalization deems this use of natural resources as efficient. It's somehow deemed efficient to take fish from the ocean, to feed, to grind them up, to then feed other fish and other animals, which are then eaten by people. All of this is a consequence of our failure to value nature's and the ocean's ecosystemic services. Only recently are we beginning to see that the oceans provide an enormous amount of value in terms of ecosystemic services. The oceans are one of the largest carbon sinks in the world. Phytoplankton, which form the basis of the trophic cascade, are essential for the regulation of not only the diets of a huge number of marine animals, but also their carbon shells are crucial to develop and a way to store carbon in the oceans. We're also beginning to see the extraordinary value of not just large animals, but small creatures in regulating ocean temperatures and regulating ocean currents. We need to understand, of course, that in climate crisis, there will be I will get to that in a moment. So let's just reflect on the fact that all of this is a consequence of us eating animals, the entirety of it. So when we look at this particular story, we can see that eating animals is a human rights issue. It's a human rights issue because communities that are marginalized and that depend on some kind of subsistence agriculture are having their subsistence destroyed simply by the greed of the consumption, not of animals directly, remember, but it's animals to feed other animals, which we then eat. It's also an issue of national security. As more and more people are unable to make a living where they are, including because of the climate crisis, they will move. And thus you can see climate refugee issues growing because of our skewed way that we provide food resources for others. It's a matter of environmental justice, clearly. It's a matter of globalized equity. For those of us who can afford not to eat animals, but to eat plants, who have access to those, we have a further obligation to do that, precisely because there are some people in some parts of the world that for various reasons do not get enough protein. All of this is going to be exacerbated and is being exacerbated by the climate crisis. In the case of this particular story, the oceans are warming and they're also acidifying. When the oceans warm, the spawning grounds change. And when the spawning grounds change, there will be no fish there at all. I hope this story encapsulates what I want to draw attention to, which is the ecosystemic, the holistic, and the intersectional nature, all of which has at its fundamental heart the inequity of many of us in the global north eating far too many animal-based products. The optimal number for equity, for justice, for human rights, for global sustainability, for those of us who can have access to it and afford it, is 0. Thank you very much.
Wow, thank you very much. That was fantastic. Let's jump over next to our New York State Assembly member, Harvey Epstein, who's himself a vegan and supports encouraging others to explore plant-based diets. Assembly member Epstein represents the 74th Assembly District, covering neighborhoods on the east side of Manhattan and including the Manhattan campus of NYU Langone Health. We're pleased to welcome the Assembly member to share more about his story, some of his policy work related to this, and what he feels is the importance of being vegan for his constituents. Thank you.
Oh, thank you for having me here, and I really appreciate everyone. So I represent the east side of Manhattan, from the United Nations down on south to the Williamsburg Bridge. So it's a really eclectic part of the city of Manhattan and a part of our city. So if you live in that part of the district, please reach out to my office or reach out to me. We also have a lot of healthcare facilities, between NYU and Bellevue and Beth Israel. It's really a healthcare row. NYU, it's got a lot of services there. So I've been a vegan for many years and a vegetarian before that. And I just don't want to make this sound like it's easy for anyone. I think these are all individual decisions and choices. But I think it's critical that people understand that it doesn't happen overnight, and people shouldn't think that, I'm going to take where I am right now and jump into a new phase of my life and I'm going to become a vegan, because that's a recipe for failure. I think it's really important to be incremental, like a lot of things in life. If you be eating chocolate cake every day for your entire life and you decide maybe you just eat it every other day, then maybe, once a week, and then maybe once a month. It's that transition. So, at 18 years old, I gave up red meat because I just didn't want to eat it anymore. And then in my life, I gave up chicken and fish. And probably for, 15 years, I was a vegetarian, not eating any meat. And probably, 10 years later, it's like, I don't want dairy in my life. And I gave up dairy. And then probably 10 years later, it was like eggs. And I kind of did this incrementally, because it's not just about having a plant-based diet. It's about what your diet is and how you can make sure that you have a healthy, sustainable diet, and make sure that you're, giving back to the world, but also making sure you get enough nutrition. So obviously it's important to be cooking and be active, but also know what to eat. A lot of people, I mean, growing up, we had a very meat-centered diet. So I didn't know how to have a plant-based diet that was a healthy environment for me. So I had to learn that, and that takes time. It's not like overnight you're going to be like, well, this is what I need to do to become plant-based. I'm going to make these 47 dishes with seitan and tofu, and I'm going to make all these stir fries. No one knows how to do that unless you were raised with that. And so if you weren't fortunate enough to be raised in that environment, take the time. Don't beat yourself up. Like, give yourself some joy and enjoyment through this process. I'm happy and healthy and I enjoy my life, but I also learned to make this work for me. And I learned to ensure that the diet I have is a healthy diet for me. So you do what's best for you. So I say that, well, I think everyone should be a vegan if we could. It's better for our environment, better for our planet, better for our bodies. And unfortunately, I've lost loved ones and friends and family because they've had a meat-heavy diet that's kind of ruined their body and they've passed away. That doesn't mean that's got to be your path. You just have to figure it out. But what you need to do is think about it. Really thinking about your steps that you want to take and who's going to be there for you. I really encourage people to have a network around them. So if you don't have friends or family who are plant-based, if you work out for a network, use things that make it easier. Like for me, like when I'm traveling, I do a lot of traveling. I use apps to help me figure out. There's an app for me. It's called Happy Cow that I use all the time. So if I'm traveling, I'll be like, okay, I need some place to eat. I'm in San Diego. I don't know anything in San Diego. I go to Happy Cow and be like, okay, these are vegan and vegetarian options that I can have. So I can make sure that I can have things that I can eat in other parts of the world. And things like Happy Cow can do that everywhere. Think about if you're traveling, maybe do you want a place with a kitchen so you can cook? Some people don't want to cook while they're traveling, and I happen to like it. I enjoy cooking, but you just need to be really thoughtful because it's not that easy in all parts of the world to have a plant-based diet. And also in your own life, I make a menu and we think about when foods are going to be and making sure I prepare foods. And I've done that with my wife and I've done that with our kids forever, but it's also something really important for everyone to do, especially if you're having a vegan diet that you can't just throw like a meatloaf in the fridge or take care of like some last minute thing. A plant-based diet isn't going to be like eating chicken and nuggets every day. It's just not going to be. You're not going to stop at McDonald's. You're going to have to be much more thoughtful and dedicated to your diet, which I think is really healthy, but it's really important. So, the really thing is, one, is really be methodical, take it slow. Two, plan like you plan other things. You plan things in your life, you plan vacation, plan your diet, plan what you eat, plan taking care of yourself. Like you have to plan exercise and make sure if you're planning exercise, you should be planning your diet as well. And three, really be thoughtful about community that you have. If you don't have one, build one, whether it's an online community through places like Happy Cow, or it's a community through other sources. There are lots of great organizations, that are activist groups that are in New York City, New York State, around the country, who are doing this work because they believe in a plant-based approach and want to, build community. Just be a part of that. And that's how you start building those relationships and feel like connected and feel like you can make this work. So thank you for all being here. Thank you for letting me be a part of it. I really encourage everyone to be thoughtful about their future because this is the only life we have. And I really do firmly believe in a plant-based approach and a plant-based diet. It's worked for me, worked for my family. Here I am, as an adult, healthy, happy, and I think you can do this as well. Thank you.
Thank you. Thanks for joining us. And could you just spend a minute and tell us about your resolution regarding Vegan Day in the state of New York?
Yeah, sure. Every year, November 1st is Vegan Day in the state, in the nation, and around the world. And so we've set aside November 1st in the state of New York. We have the governor sign a resolution every year proclaiming Vegan Day in the state of New York. We'll be doing that again this year. It's really just to make sure we raise the issue of veganism and make sure that people understand why it's important to have a plant-based diet. We have other pieces of legislation I should have mentioned earlier around making sure that we have alternatives to, like in growing up in public school, there was always milk and milk and then chocolate milk. So we want to make sure that people have non-dairy alternatives in school. So we want to make sure that kids who have a different path have access to healthy alternatives, and my son grew up on drinking almond milk, and he's still to this day at 18 years old, that's the only thing he'll drink. So I think it's, we want to make sure that our kids have options in our schools and options in our meals too. So luckily in the city of New York, Eric Adams has been focusing on plant-based meals and having at least an option plant-based meals for public school students in New York City, and now having a plant-based day. But it doesn't happen around the state of New York. So we have legislation to advance plant-based meals to ensure that kids who make a choice around having a plant-based diet can have that in the public schools, because it's not that easy for parents, and most families have their kids eating at school. So I want to make sure that those schools are healthy and accessible for people who have plant-based diets.
Great. Well, thank you. That's fantastic. So important to have these, legislative discussions. Otherwise, how can we advance policy forward? And what you just talked about is actually a perfect segue to our next speaker, Dr. Robin Ortiz, because she's a board certified physician in both internal medicine and pediatrics at NYU Langone Health. And she also is planning to discuss plant-based diets and their importance from a perspective of both health equity and the intergenerational perspective. So ties in very nicely with this discussion of the importance of meals in schools. In addition, Dr. Ortiz will discuss the joint initiative from New York City Mayor Eric Adams and the American College of Lifestyle Medicine to offer free lifestyle medicine training for healthcare providers. Welcome, Dr. Ortiz.
Thank you, Dr. Loeb. I'm going to go ahead and share screen right away so we don't waste time and we can jump right in. I'm really excited to talk to everybody today and share this place with all of the fellow panelists. I think I'm actually going to comment on things that each already have, so maybe will be a nice tie-in. But I really need to start with some of the semantics, even though some of us are new to this and some of us have been involved in this space for a long time, and the terminology has evolved and it probably still will continue to, but I think it's really important to lay the groundwork here. So we're going to start with the diet in terms of literal dictionary definition. It's a verb known as what we are eating, or to eat, to cause to eat less according to certain rules, can actually be a deficit framework, as opposed to the noun diet, where we're talking about food and drink that's regularly provided or consumed. And that's actually an important distinction, because we're talking here about the generalities of what our lifestyle should be. And so there's more of this potential propagation of emotions that come with the idea of dieting or lifestyle, and that's important to name. And that goes along with some of the terminology and evolution we've seen. So there's a vegan diet, which we're in Veganuary, a diet that does not include food that comes from animals or animal sources. And I want to importantly emphasize, not officially the definition, but potentially consuming any food at all that does not come from animals. And so not necessarily focused on what a plant-based diet tries to emphasize is the consumption of predominantly whole foods that come from plants. So fruits, vegetables, we heard about legumes, other sources. And this leads to the concept of what our lifestyle is, the typical way that an individual, group, or community may eat or practice. And this is really important because I'm going to be talking about lifestyle medicine that centers a plant-based diet, but that's not necessarily independent of considering all the other factors that may inspire us to be vegan. It's just that we, from a health perspective, want to center the predominance of whole foods. And it is standard of care practice. Any physician knows, and we already heard today, thank you, Dr. Gonzalez, that many different organizations, inclusive of the American Heart Association and others that endorse the DASH diet that was referenced, as well as the American Cancer Society, emphasize that really these are plant-based diets. They may not call them that because we had to start with semantics to see why, but really we're talking about whole foods, vegetable-forward diets. And this is where grows in the American College of Lifestyle Medicine, centered on practicing how do we actually make this happen clinically and in our communities and with our patients. Here's an excerpt, the American Cancer Society, from their website, not naming it, which is important, but to center a variety of vegetables, foods high in nutrients, and limiting meats, sugar-sweetened beverages, and those foods that are processed. This overlaps with the new Life's Essential 8 factors defined by the American Heart Association, inclusive of all of those that we just heard from our assemblymen on, that can include exercise and other things we plan, sleep. All of these behaviors collectively can lead to what is defined as cardiovascular health, and that's associated with decreased morbidity and mortality across the entire life course. But importantly, research shows that this trajectory of having the ability to attain ideal cardiovascular health is often established by age 8. So when we talk about solutions and our impacts, we need to think about the children that are around us and how we can change their trajectory towards health. And the American College actually shares the principles of how to promote this. We can see this is the lifestyle behavior-centered model of medicine. But we can't talk about these things without the important and essential topic of health equity. And just past the birthday of the great Dr. Martin Luther King Jr., of all forms of inequality, injustice in healthcare is the most shocking and inhumane. And unfortunately, with the new publication of the Essential 8 from the American Heart Association, we also had a new publication showing disparities in it. We see that for diet, which is predominantly plant-based, again, as we spoke of, those who are non-Hispanic Black by identity, but also those of who identify as Mexican and other Hispanic, which is we don't have as great of disaggregated data as we need here, but we can see lie lower and closer to that red zone, which is lower cardiovascular health, as well as all the other factors. So it brings us back to thinking about lifestyle medicine approach, which it needs to be overlaid with a health equity approach. We have to think about some of the amazing policies that our assemblyman and our mayor are working on and others, but also to address residential segregation, resource distribution, biological community diversity, landscape heterogeneity. And there are examples of this that we could go on for days, originating from slavery and other practices of racism and discriminatory policies. There are examples, for example, we see that farmers who identify as Black, their land was taken. We have targeted advertising still going on today in marginalized populations, and disproportionate exposure, as we heard about earlier, to environmental factors related to our food originating sources. I've written about this in the media, but others are really studying it and doing even a better job of propagating this knowledge out there, inclusive of Dr. Mary Bragg. I'll give her a shout out at NYU. And this is just an example of that disproportionate advertising of unhealthy foods. Here's an excerpt that I think we have to center this experience of North Carolinians who are exposed inequitably to the toxins due to animal and factory farming. And so this is something we don't always think about, but those toxins being sprayed, the exposure to animal waste, disproportionately affecting communities who are already marginalized, already experiencing health inequities and disparities that we saw, are now being exposed disproportionately to harmful chemicals and harmful waste products. So we have to contextualize our approach to a plant-based diet, to lifestyle medicine, to mitigate disparities by thinking about the structural things that can lead to solutions. And we have to constantly think in our minds about the historical, cultural, and community factors that contribute to individual and communities' abilities to actually access a plant-based diet or lifestyle approach. Although it may be the goal, we have to meet individuals and communities where they're at and not place blame or shame on their approaches to lifestyle. And I have one solution that I'm actively working on and would love partners to do so. It is to address this from a life course trajectory. We know that historically we have propagated inequities and inequalities in our healthcare system in our country. And one way to do that is to think about the adult caregiver. Many adults come in contact with children and are also trying to work really hard on their own health, where that child can be a potential motivator and a partner, but also it then has the potential to lay the foundation and break that trajectory late at age 8. And lastly, I'm going to just introduce so we can get to the course that Dr. Loeb mentioned. There are themes of how we can do this collectively in society, especially in medical organizations. We can engage clinician education. We can talk about patient and family self-advocacy and thinking about individual and community factors, such as culturally tailoring our approaches, thinking about champions in our communities, like partnered organizations and community-based structures like churches, and then supporting policies and advocating for systems change, as we heard about being done here today. And some of that is happening right here. We're going to talk about that because the American College of Lifestyle Medicine committed over $20 million to free training of providers or medical staff or those who are involved in potentially influencing lifestyle practices. And this was also inspired, or the ACLM was working on this for a long time, but motivated additionally by the White House's initiative recently having a hunger, nutrition, and health conference. And this partnership inspired their investment in many providers being able to access a course, which we are so grateful to have our leadership at NYU, but also just the mayor being able to provide access well beyond our institution across New York City. This is also available throughout the country in other ways, but we have here on the bottom access codes I'll draw your attention to on the left for NYU and on the right for others in New York City. But this initiative is over 5 hours of continuing education, or CMEs, and it is an introduction to lifestyle medicine, as well as centered on food as medicine and how kind of gathering that information and skills, which we all need to start. I encourage those to do this who even are providers or staff who aren't necessarily interacting directly with patients, but are in the medical or organization or system. And it's very easy to enroll. You can even scan right here. So I'll keep this up for a second and just say thank you so much.
Fantastic. Thank you very much. That was great. And we will send out some resources afterwards. So if anyone who didn't catch that, not to worry at all. So let's jump over to our final speaker, Lianna Levine Reisner, who's building a multicultural movement for health as president and network director of Plant Powered Metro New York, an organization that she co-founded in 2019 to empower local communities with evidence-based plant-based nutrition. She holds a master's degree from Case Western Reserve in positive organization development and change, and a certificate in plant-based nutrition from the T. Colin Campbell Center for Nutrition Studies. Lianna is here to discuss some tips for anyone who wants to try a plant-based diet and some helpful resources.
Thank you so much, Dr. Loeb. It's wonderful to be with all of you, and I'm definitely going to be building off of so many things that have been said already. Now we're talking about the how-to. How are we going to make plant-based living possible in our day-to-day lives? I came into this as a layperson. I found that I was able to reverse the symptoms of endometriosis with a healthy plant-based diet, and have been in contact with so many people around the country and the city who have changed their diets and found relief from various health concerns. And it is possible. So as Dr. Loeb mentioned, the mission of our organization is to bring empowerment to local communities through plant-based nutrition. We do a lot of educational work, offer support and resources, and we're here to try to really build a movement. It's not just about knowledge, it's about change. And how do we achieve change? Well, for us, the idea of empowerment is so important. And what we do is we give each other lenses to see the world, to see our food system, to think about healthcare in a completely different way. And in a way, it's really helping us go back to basics. It's about where has our food come from throughout millennia and what is really going to fuel us as human beings, and how can I do this in the comfort of my home with friends and family and make it really achievable. So one of the first things we often talk about is knowing your why. What is going to motivate you to take the next step? For me, I was motivated because I didn't want to have the health issues that I was having before. And I continued to be motivated because my mother had a very aggressive form of non-Hodgkin's lymphoma when I was in college. And I watched her go through so much trauma as she dealt with her cancer. And I want to do everything that I can not to follow in her footsteps and to figure out how to take control of my genetic expression, even if it's not perfect. I know that food is a big piece of that. So think about your why. What brings you into this conversation in the first place, and what might be your North Star as you go about making change? So just to sort of encapsulate what a whole food plant-based diet looks like, we talk about really core building blocks: fruits, vegetables, whole grains, legumes, and a little bit of nuts and seeds. And for many of us, of course, we're supplementing with vitamin B12 and a few other supplements as needed, but it is a whole food diet, which means we're not downing all the supplements. We're not spending all the extra money on that. We're just buying food. What that means is when we go out and we go shopping, if you're looking at, again, putting on the lens of empowerment, seeing your food and the food around you with this new consciousness, it does take time. So I encourage you to go out, look at and see what your options are in your grocery stores, and to just spend extra time there. You can look at the different healthy zones in your grocery stores. You can shop online in different ways. And what we always talk about is shopping around the perimeter of the grocery store. You want to look for the produce first, the colorful foods that are going to nourish us, and then to go into the aisles, read labels, look and see what's actually in the food that you're purchasing, and to find the things that are simple, the whole grains that come in a bag that you can pop into a pot on a stove, and the dried beans or the canned beans, frozen vegetables, things that easily come together to make a simple meal. But we also have to know our weaknesses, because we all come into this with certain food dependencies, perhaps certain food addictions, and a sense of just knowing our own bodies and what will cause us to be pulled in another direction. For some people, it's cheese. For others, it's chocolate. And you can definitely still have chocolate eating a whole food plant-based diet, but you're going to eat it less and you're going to eat it differently. And also, as we shop and as we purchase food, we have to communicate our needs to others, whether you're in a grocery store looking for something, or you're somebody who, especially if you're supporting patients who are trying to make choices, and they are dependent on food pantries or other food support systems. We have to communicate our needs to the people around us as much as we possibly can. One of the core principles, which Assemblymember Epstein was talking about, is to prepare your environment. For anybody who knows the Montessori educational philosophy, when you go into these Montessori schools and preschools, what Maria Montessori suggested is that in order for children to be successful in their environment, they need to have structure. They need to have certain level of preparation to advance their development and their learning, so that they can be self-guided and have success, and have each success build on another. And of course, the same is true for adults. So if you have a pantry that looks like this, that is not going to be a space for you to really embrace your own health. So we have to sort of do a reset, look at our kitchens differently. And while you may not have the most beautiful fridge and pantry that you see on the screen here, we can always strive, and we can try to increase the natural color variety of what we have. We can try to do a little bit of reorganization. We can put the food that other people in your household might like to eat in a different quadrant, and you get a zone that's for you. And just thinking again, how do we set up the environment for our own personal success? So here are a few examples of what folks like us eating a healthy plant-based diet like to eat. For breakfast, we have lots of different varieties of oatmeal. It's a very malleable kind of dish. A chia pudding, smoothies of so many varieties, whether they're greens or fruit-based or both. We serve a lot of smoothies to my children because that's sort of the main way to get greens into their diet. And you can make scrambled tofu on the weekends, or you can cook up some healthy plant-based whole grain pancakes on the weekend. There's so many different ways to sort of get a rush from the excitement of plant-based eating at breakfast time. At lunch, when it's a little harder, and maybe you want to prep something quickly to bring with you to the clinic, to the hospital, there are lots of different ways to do it. Of course, stews and soups are a mainstay at this time of season, time of year. Lentil soups, all different kinds of bean soups, salads, of course. And on the left, you see our version of a tuna salad. Instead is a chickpea salad. You can make it in similar ways without hold the mayo, please, and add in some of those delicious onions, and you can keep your capers or your pickles if you'd like, put it on some whole grain bread, and you've got a tasty meal. And dinner, of course, so many different options. You can do a taco bar at home with a lentil or bean-based filling. You can do different kinds of brown rice dishes with lots of vegetables, sweet potatoes or potatoes. In certain families, you can make like a potato bar, and everybody gets to put their own toppings on. Different varieties of pasta dishes, spring rolls. You name it. There are so many ways to slice and dice plants to make them work for many meals. When we talk about replacing different foods, I'll give you a few of the hot tips on healthy swaps. So when we want to replace the flavors and textures of meat, we're looking at especially lentils and mushrooms and tofu. There's amazing things that can be done with tempeh and with jackfruit. I like going out to the vegan restaurants to see how they work with those in order to learn how to incorporate those into how I eat, but I stick with the usual stuff, the beans and the mushrooms, to make that sort of umami flavor that we get from meat. With dairy, there are so many different kinds of plant-based milks. If you don't like one, it doesn't mean you won't like them at all. So go and try different flavors. There are non-dairy cheeses. Of course, so many of them are filled with lots of processed ingredients. So you'll want to look for things that are nut-based if you're looking to improve your health, like tree-lined cheeses are one example. And then a lot of people like to add nutritional yeast to their homemade cheese sauces, or you can even sprinkle them on your salads instead of having a Parmesan cheese, just to get that nutty flavor that comes from nutritional yeast. It doesn't taste just like dairy, so be aware, but your palate may come to enjoy it over time. When it comes to eggs, we often take flaxseed and chia seeds, and if you take a tablespoon of that and add 2.5 to 3 tablespoons of water, mix it, let it sit for a little bit, and it comes to the consistency of an egg. You can add that into baking. You can use it in other ways. It's just a helpful approach. Chickpea salads, as I mentioned, can replace an egg or a tuna salad, tofu scrambles and quiches. And we also, in the whole food plant-based community, a lot of us reduce or eliminate our oil consumption because it really brings the calorie density of our diets down. And so what we teach at Plant Powered Metro New York is how to steam or saute the foods that you might otherwise drizzle with oil or douse in oil in water or broth. And it actually brings out the flavors really beautifully. You can also replace oil with pureed fruits when you're baking, and use different kinds of salad dressings that don't use oils, like putting a soy sauce together with some citrus and ginger and make a nice Asian dressing, using vinegars, using tahini paste, and also using the juice from the chickpea can called aquafaba. There's so many amazing things to do with that. I'll leave it at that. That's sort of 2.0, the next stage of plant-based nutrition education. And we also try to reduce sugar consumption. So we want to instead choose fruit, dried fruit, definitely in moderation, because again, it's very calorie dense. But there are so many ways to replace sugar in our diet, and we teach about how to use dates to sort of make a date paste out of it and add that into your baking goods. When I make a banana bread at home, we puree the dates up with water, and you put that in instead of your sugar. And you might have to add a little extra flour just to compensate because it's a liquid. But it is doable, and certain kinds of sweeteners are a little better than others, like a date sugar or a blackstrap molasses, which has higher iron content, but it has a richer molasses flavor, which some people don't like. So you have to experiment. And for us, we often say, give yourself time away from sugar and then come back, and you'll find that your taste buds are ready for less in your diet. So one last thing just to say about the food, which is building off of what Dr. Gonzalez was talking about. Where do we find protein in a plant-based diet? We find it richly in our legumes. Every kind of bean imaginable has a wonderful source of protein for us, and also in the byproducts. So soy, for example, soybeans create tempeh and tofu. You can find it also in abundance in certain whole grains like quinoa and amaranth. Just check labels, do some reading. You'll find it's pretty simple to reach that RDA, even if you're, and certainly if you're not athletic. For someone like me, I'm 5'2", and I have to eat perhaps 50 some grams of protein per day. It is not hard to do that when I add beans to my salads or have them as the main course. So just to build on, again, what Assemblymember Epstein was saying, build your support system. There are people out there who are doing this every day and who love it, and team up with each other. You can find all sorts of resources online, and we definitely encourage and invite any of you who are interested to join the Plant Powered Metro New York community. We go out and do all sorts of educational work in the community, and want to support both you and your patients and the people who are in your lives to make a sustainable and loving change to plant-based eating that will nourish you, not just sort of the junk food vegan approach, but really based on what we know about the evidence of how to promote health day to day. So many ways to take the next step with us. The easiest thing to do is to go to our website, plantpoweredmetrony.org, and you can learn about our upcoming events. We're right now in the middle of one of our Jumpstart programs where we help people make a really big transition into a plant-based lifestyle, and we throw all of this educational information at you and cooking demos. We're hoping and planning to bring it back in March, and so if you join our mailing list, you'll find more information about that coming out very soon. Here are some ways to contact and follow us, and I hope that I'll hear from you soon. Thank you so much.